on Africa Health Check.
I have not been vaccinated for COVID because of the reactions, so I think I was not encouraged to go take my own.
It's there, but we have to struggle to do the recovery. As people are responding to the vaccinations, things are moving in the right direction.
We look into the African continent's vaccination status.
I think there's still a lot in terms of R&D, research and development.
And discuss the measures to be taken in our quest to be self-sufficient. Welcome to Africa Health Check, where we reflect on the health status of the African continent. I am your host, GOGONTLEJANG PHALADI. On today's episode, we will be talking about vaccination awareness and self-sufficiency for the African continent. To help me unpack this topic, our special guest for today is Dr. Chibuzo Opara from Nigeria, who's the co-founder at Drugstock. I'd also like to welcome our usual commentators, Dr. Marianne Mureithi, the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Before we hear from these panelists, let us have a look at this episode's feature.
I'm Nikes Dembi, the head of science office at Africa CDC. I think the whole vaccine strategy as part of that architecture was built from the science office before implementation by the divisions. I think to tackle future health crisis, a lot of effort in terms of capacity building have gone through the health system on the continent. The lab level, the lab capacity has been built. If you look at where we started during the early phase or acute phase of this pandemic, we only have 2 countries were able to diagnose, COVID-19. And now we have almost virtually all countries that are able to do so. I think this is very important. And the same facilities that are being used currently to be able to detect the virus or diagnose at least COVID-19 are those facilities that were primarily really set up for HIV, for example. That shows the capacity to repurpose some of the facilities as part of the testing and also as part of the response to future pandemic. I think we have seen the huge momentum around vaccine manufacturing, for example. It's quite important and significant to mention that the Africa CDC and the African Union, we have released what we call a framework for action. And that framework for action guides the continent in terms of how we can build infrastructure around vaccines, which platform can be used, which type of vaccines, to tackle about 22 priority diseases. And among those 22 is very important as well, there's what we call disease X. It's actually those diseases that we don't know, or non-pathogens that might come in the next 10 and 15 years. So we are more prepared and well prepared. There are more than 17 countries now that have expressed interest in terms of vaccine manufacturing, which is very important. It's one of those tools, diagnostics, therapeutics, and vaccines that can be used to really build a resilient health system across the continent. I think there's still a lot in terms of even R&D, research and development, and also the messaging, the way we frame it to be able to really reach out to those, the youth, contributing to more than 50% of our African population. I think it's quite important at this stage that we start tailoring the messaging, be sure that what is currently around vaccine hesitancy actually kind of control at some extent. I think the SLL kickoff that happened during this week is going to be a good start where multiple partners, in terms of risk communication, community engagement, are all coming together to be able to provide support so as to move that target from 18% to 70%. It's doable. It's just the right framing, the messaging, and then the targeted population we're looking at. The message to the continent, two things, I think, let's learn from COVID, because this is a very important moment. We have learned from COVID-19. We're now ready to learn from monkeypox. There'll be more and more some of these new pathogens. And then it's quite clear that the zoonotic transmission will not end. That started a long time ago. So I think let's build on this current pandemic to be able to be more prepared for future pandemic. I think those three things I've mentioned, the ability to detect, to test, detect, to be able to trace the virus. We do that with the Pathogen Genomic Institute we're doing. We can track the virus across the continent. Ability to also provide therapeutics, and also being able to provide vaccines to the 1.3 billion people that we care across the continent.
And that is our feature story for this episode. Remember, we are discussing vaccination awareness and self-sufficiency, and I'd like to welcome Dr. Opara to the show. Thank you so much for joining us.
It's great to be here, Gigi.
Dr. Opara, I know you wear many hats and you're really well experienced in various fields. Maybe let me just give you this chance to just briefly talk to us about your background and what you do and the different roles that you currently serve in.
Great, Gigi. So my background is I'm a medical doctor and I'm a health economist. And I've worked in different organizations, from the World Health Organization to the World Bank, the IFC, Nigerian Sovereign Wealth Fund. And I currently work as the CEO of Drugstock, which is a cloud-based pharmaceutical distribution platform. We connect manufacturers of good quality pharmaceutical products to hospitals, pharmacies, and patients across sub-Saharan Africa. It's great to be here, Gigi.
Thank you very much, and we look forward to your insights. Maybe just to dive right into it, Dr. Opara, what is the current status of vaccination awareness and self-sufficiency, broadly speaking, on the continent?
So I think there's an awareness. I mean, COVID, everybody got to hear about COVID, and there's awareness. I guess active awareness of what of having the vaccine and trust in buying into getting vaccinated is what we're dealing with. I think it's slowly rising across the continent. I think the initial logistic challenges and the availability of the vaccines played a role. And then when the vaccines became available, the waves of illnesses had passed. So there was this lag between, do we have the vaccine? Do we need the vaccine? And should we take the vaccine? Playing in people's minds, that contributed to the acceptance. But it's gradually been rising. And I think in a number of countries more than the others, I think that over the next couple of years, it will continue to improve. And there's been a lot of effort and work by agencies like the Africa CDC and other players who have driven the effort largely to ensure that vaccination rates have risen across the continent.
Thank you for that. You mentioned a lot about key players as well as stakeholders, which leads me to my next question. Who are currently the major stakeholders or the key players in terms of ensuring access and availability of vaccines in Africa?
So I think with regards to the players, obviously you have the manufacturers of the product. Essentially, the drive for vaccination is still a very governmental and super governmental effort. Lots of national governments, super governmental national international agencies like the Africa CDC, the local national CDCs in different countries have also played a keen role. Obviously, the World Health Organization has taken center stage, the regional office out of Congo, I think, and different, some countries have, largely spearheaded the efforts in trying to domesticate local production, as this continues to remain an interesting dynamic on the continent where, in the last couple of years, what played out was people who could either muster the cash to pay for the vaccines, or who controlled the supply chains, or who controlled the production, sort of got first dibs on the product. And you've had a number of interesting conversations playing out on the continent where, production has been driven in some places. Interestingly, countries like Senegal, the Pasteur Institute, have featured quite highly on the list of stakeholders to watch out for. I know South Africa, Ghana, Kenya have all led the effort in trying to domesticate production. Countries like Egypt, Nigeria can also be huge players if they're able to deploy their resources. So there's a number of interesting stakeholders that are currently active, and those who are, circling around wanting to throw in their hats to the playing ring for this.
Dr. Opara has thrown the ball to you, Dr. Marianne, to sort of give us a status update on where we stand in terms of the COVID-19 vaccines in Africa. And I want you to just also touch on what are the major things that have worked well with the rollout of the COVID-19 vaccines and what has not worked out.
So again, this is a topic I'm quite passionate about, and it's fantastic to hear Dr. Opara talk about where we are and what we still need to do in terms of increase our infrastructure and have everyone vaccinated. We've had several successes and also several failures, but as now as we speak, Africa, we can see the numbers rising in terms of people getting vaccinated. I can give you for an example, in Kenya, where I am, we are around 20% of the population fully vaccinated. Nigeria, because I keep an eye on these things, Nigeria has around 15% of people vaccinated. Gigi, in Botswana, you're doing very well, around 64%. You need to tell us the secret. Probably it's many people watching this show and getting to learn about vaccines. So we need to still talk about these vaccine drives, and we can see now that we are seeing a new wave coming. I sit near the largest hospital in the East and African region, and actually I can see the queues for people getting boosters and having more vaccines. The lines are growing each day. So meaning communication, we are getting better in making people believe that these vaccines are good, not just making people believe, but people actually seeing that vaccines work. Vaccines are saving lives, in that even though you get the COVID infection, it's not as severe as we saw in the year 2020. Why is that? It's because of vaccines. Our bodies have learned how to fight this infection. And how do bodies learn how to fight infections? Is through vaccination, also through natural infection, but vaccines help boost how your body responds. So what I'd like to see more, and this is again addressing the failures we saw at the beginning, we need to now start talking about, and I love this conversation, having these vaccines produced within our African continent so that we can have them readily available. And then if we have these manufacturing plants here, we can quickly tweak them or modify vaccines so that we can be able to fight the next pandemic. I'm always drumming about that, because we are now in an era where we're going to see more emerging and re-emerging infections. Again, the reason for this is another whole program altogether. So we need to be able to be ready, where we can manufacture interventions very quickly, have this infrastructure here, have the whole supply chain, that these vaccines are not just available where they're being manufactured within the continent, but they can reach the most remotest parts. So making sure that these vaccines are stable, the cold chain has been addressed, their stability, etc. So we need to have all these players in place. We need to start having more of these conversations, and we'll have more successes to talk about.
Thank you very much for that, Dr. Marianne. Passionate indeed. I'm going to go to Reverend, who's also very passionate about this particular area. And I want you to share with us, Reverend, what do you think has worked very well, and where do you think have been the major deficits in terms of rolling out this biggest, largest ever immunization drive that Africa has ever had to roll out?
Yes, I believe that it is all education. It's creating an awareness of the importance and the value of immunization and vaccination. We say that routine vaccinations and immunizations are an integral and important aspect of any strong and functional healthcare delivery program anywhere in the world. And I do believe that there has been proven data, especially in Ghana at the beginning of the year, using the COVID vaccinations drive as a backdrop. It was not good enough until Ghana jumped on the World Immunization Week program, African Vaccinations Week programs, which are all WHO initiatives. And the result was phenomenal. Why? Because not many people understand anything about vaccination or immunization. And not only even about COVID-19. Routine vaccinations begins with from birth, go through childhood days into adulthood. And it's proven that there are many vaccine preventable diseases. And the reason why many people are still succumbing or are not getting well from certain diseases is because they do not know. They do not know the value of vaccines. They do not know. And the only way that, as I believe, has helped Africa so far, Ghana, Nigeria, South Africa, Kenya, is advocacy. Talking about it on TV, in the churches, in schools, everywhere, about the benefit of vaccines, of immunizing your children, immunizing, through teenage years, and even as adults, taking your flu jabs, and so on and so forth. So I do believe that the number one thing that has helped, scale up or boosted, people's response to vaccines is this awareness is education. At the end of the day, awareness have two objectives: is to improve public acceptance of vaccines and immunization, and also to decrease vaccine hesitancy. So I would say, Gigi, that the thing that has helped so far is education, advocacy, talking about it. The other thing that has worked against it is because Africa is predominantly, not predominantly, but many of our people, our cultures, are religiously inclined, faith inclined, and some believe that the sources of sicknesses and the way to treat them have nothing to do with science and so on and so forth. So Africa has this challenge, and then fake news and disinformation and misinformation. So on the one hand is this public awareness, education campaigns, mass campaigns, and on the other hand is the negative dimensions of quote unquote religious beliefs, and then fake news, misinformation and disinformation. So these are the two things that I can cite at the moment.
Thank you very much for that, Reverend. Insightful as always. I want us now to talk more about what needs to happen to ensure that we build self-sufficiency in terms of availability and production of vaccines, which Dr. Marianne touched on slightly, but I want us to dive into that just after the break. But now it's time for us to hear what people on the street had to say.
Actually, I had a jab last week. I'm really feeling good, and that jab is very good to us for health, to stay healthy and to stay active. Actually, from that time when I got the jab, at least I'm feeling very strong than before. So I encourage everyone who didn't get this jab. It's very good. To me, it has really worked.
I have not been vaccinated for COVID because of the reactions I read on the net, and I see on TV, and people I know had reactions about it. So I think I was not encouraged to go take my own.
Welcome back from the break. Remember, we are discussing vaccination awareness and self-sufficiency in Africa. And before the break, we had our panelists giving us a situational analysis on where we stand in terms of vaccination and self-sufficiency in Africa. And now I want us to take a step further. And I'm going to start with you, Dr. Opara. Can you just tell us what are the key points, key elements or priority areas where we should be focusing our investments towards to ensure that we are able to produce and as well as dispatch vaccines in Africa? What kind of capacity do we need?
Thank you very much for that question, Gigi. Supply chains are actually very is a topic that I actually find very exciting to speak about. And when you look at the supply chain, right, you almost need to look at it as a living organism with different systems. You have your production, your storage, your transportation, your last mile distribution, you have your uptake, you have your governance frameworks that sort of interlock all these different components, making them come alive. You need your visibility from end to end so that you can plan how much vaccines you need and how much vaccines you're able to distribute. Otherwise, you have the vaccines piling up somewhere and being absent some other place, or people not having things delivered at the right time. Essentially, when you're doing this, you need to think about it in terms of think about this, right? If these vaccines oftentimes require certain types of skill to manufacture them, and these skilled professionals might not be willing to move to certain places where their kids may not be able to go to school or the kinds of schools they want. And things like this. So we need to think around, how to move this strategically forward. It's not about every country getting their own production. If a country has certain skills or has built certain capacities, I think it's important to link these capacities to active markets. Right now in Africa, for instance, we fly vaccines 96 hours at least to get them to places, to get them to Africa. The least amount of time you fly is 96 hours. Then you fly to the country that needs the vaccine. But if we had this production in parts of Africa, these flight times could be cut down to 4 hours, 8 hours, 6 hours, which makes it cheaper for us to store these vaccines. Because with vaccines, you're thinking about storage as you're traveling and all that. And when you plan vaccine production, you need to plan it in consonance with all of these things in mind, not just, I have a factory and that is it. We need to have these governance frameworks and the planning that go along with this production capacity and abilities to sort of bring this down. It's almost like planning a whole logistics from before you spend the first amount of money on the manufacturing facilities. You need to understand what your consumption might be in the next 5 years, what your range of vaccine products might necessarily be. I don't want to be the one who is sort of, how to say, belling the cat or whatever. But the point is that, today it's COVID. Tomorrow it could be Marburg, another outbreak of Ebola, some other strain of that group of viruses that are happening, because there's deforestation and all those sorts of things that are happening.
Absolutely, African way of doing things. I couldn't agree more. We're almost wrapping up the show, and I know this is an area that we're really passionate about, all of us at Africa Health Check, but I'm going to allow Dr. Opara to give us the final word regarding the importance of vaccination awareness, but more importantly, self-sufficiency see and what we should be looking forward to as Africans. So should we lose hope, or should we remain hopeful that one day we will be able to indeed manufacture all our vaccines in real time, make sure that they reach the people who need them the most at the right time, and ensure that we also use the labor, the expertise of African experts, as Dr. Marianne has really assured us that we have plenty of those.
I think the story of vaccination in Africa is one of similar to the stories that pervade our continent. You know, it's a very aspirational continent, a very young population, a population that is keen to take its place on the world stage. But at the same time, you know, we've battled with a lot of things in the last few decades, from infectious diseases to issues around infrastructure to issues around, human capital and things like that. I think that, you know, the antecedents of all this, you know, there's stories that can be told and told, but at the end of the day, it is here. We are here, and we're now the people who have to take the continent forward. And I don't approach questions like this typically with, will we, can we? I think you either do or you don't do. Like, there's no, can we try? Should we? Is it? I think you just do it, because at the end of the day, what do we do? Cross our hands and fall over? Like, we can't afford to do that for ourselves, for our children. And I think with vaccination, right, it is only going to keep increasing. And the great thing is that we've had this herd immunity that has blown through the population.
Thank you so much for that really powerful and Pan-African parting shot. It's not about if, it's indeed about when. So thank you so much for that, Dr. Opara, as well as Dr. Marianne and Reverend Anthony Champong, as always, for taking time to share with us your insights and having this thought-provoking conversation. When it comes to investing in vaccination and vaccines in Africa, it's really not a matter of whether we have sufficient funding. It's about whether we have sufficient political will and commitment. And this is something that we need to continue to really advocate for if we indeed put human life in such high value, in such high regard. Let us make sure that we put our words into action and put money into that by ensuring that we invest in things that prolong that. And that thing is indeed vaccination, as vaccines have proven to save lives and give people a much longer lifespan. This is Africa Health Check. Thank you so much for joining us today. We would love to hear from you, so do make sure you connect with us on all our social media platforms and give us the feedback. Until we meet again, same time, same place, same date, remember that the future is Africa, the future is today.